Can you take fish oil with an ACE inhibitor? For most people, yes. And it's generally safe. But there's one effect most people miss, and it's worth understanding before you start. I'm Steve, a pharmacist, and on this channel I break down supplement and medication questions using real evidence. Here's the thing about fish oil. It's mostly known for heart health and triglycerides, but it also has a mild blood pressure lowering effect of its own. We're talking about 2 to 3 points on systolic blood pressure on average, especially at doses around 2 to 3 grams of combined EPA and DHA per day. Now, ACE inhibitors are also blood pressure medications, so when you stack fish oil on top of your ACE inhibitor, you're potentially adding a small extra drop in blood pressure. For most people, that's completely harmless. For some people, it's worth watching. There's no major direct drug interaction between the two. The research on this is actually reassuring. One trial in patients already taking ACE inhibitors found that fish oil improved triglycerides and clotting markers without dropping blood pressure further in any meaningful way. So the additive effect tends to be modest in people already on blood pressure therapy. That said, here's who should pay closer attention. If your blood pressure already runs low, if you're over 65, if you take multiple blood pressure medications, or if you have kidney disease or heart failure, even a small extra drop matters more. Same goes if you take a blood thinner, since fish oil has mild antiplatelet activity. So, what should you actually do? 3 things. First, start with a moderate dose. About 1,000 milligrams of combined EPA and DHA daily is a reasonable starting point for most people. Second, take it with food. That cuts down on nausea and the fishy aftertaste people sometimes complain about. Third, check your blood pressure for a few weeks after starting or after increasing your dose. If you see a meaningful drop or you're feeling lightheaded standing up, that's your signal to talk to your pharmacist or doctor. The bottom line, fish oil and ACE inhibitors are generally safe to combine for most people. The blood pressure effect is real, but usually small. Monitor when you start, watch for dizziness or unusual fatigue, and loop in your pharmacist if anything feels off. The full guide with references is on LiveHealthyRX.com, link in the description. If this was helpful, consider subscribing. I cover these kinds of supplement and medication questions every week.